Life's rolling along, no major issues, but then something happens. You get hurt or you get sick and you need medical attention. So you get that, but then the bills start piling up. These things can be devastating, even if you have health insurance. 40% of Americans cannot cover a surprise $400 expense. Then you have the debt collectors, and they have been busy. $1.8 billion worth of medical debt sits in Ohio as we speak. Then the very health system that's treating you can also sue you for hundreds, if not thousands of dollars to collect their money. All of that can lead to bankruptcy, evictions. 2/3 of all bankruptcies can be tied directly to medical debt. For so many people, medical debt feels like one big old trap that they just can't get out of. And that's why we're launching a new project called Diagnosis Debt. We're going to shine a spotlight on this huge problem, but we need your help. Share with us your medical debt stories.
Our first Diagnosis Debt story is going to take us all the way to Capitol Hill.
As a matter of fact, guys, we found a medical bill that is so egregious, it caught national attention. And in fact, the father of that patient lives right here in Ohio, and his fight found its way to Washington.
1 out of 4 people who seek medical attention will get a surprise medical bill.
Paul Davis should know. His daughter, Elizabeth Murrow, is one patient who was certainly surprised.
More people need to be aware of what's going on and how prevalent the problem is and realize that they are the next victim.
With that warning, let's take you back to 2015 when Elizabeth had back surgery and then got an $18,000 bill.
Had she gotten any notification prior to that?
No, that was, I thought, the strangest part.
Paul called the hospital system about the bill. He says the woman on the other line asked how much he can afford to pay and then said,
"Would you be willing to pay $5,000? So she's talking me down.
Did that seem odd to you?
Oh, yeah, it did.
Reluctantly, he paid the $5,000, only to find out that $18,000 bill was for a precautionary urine drug screening. Nothing else. A screening.
As she describes it, the urine test was sort of an oh, by the way.
And oh, by the way, she owed thousands of dollars.
Ashamed of my profession that as medical people would do this to innocent people.
You see, Paul is a retired physician, a doctor who once ran his own family practice before teaching medicine to future doctors. He's seen what's happened to healthcare charges.
Almost all medical bills are paid by somebody else's money. Nobody has a stake in it, you know, except the insurance companies.
Paul tells us his daughter had no idea the urine test would be taken out of network.
If they had been in network, they would have paid $100.92.
For that same test?
For that same panel of tests, yes.
$100, not $18,000. Paul's billing problem was picked up by Kaiser Health News and the Cato Institute. And then, as he was sitting in his home in Findlay, Ohio,
phone rings, I look, and it says, the White House. And I go, huh.
The White House was putting together a roundtable on fair and equitable billing to be held in the West Wing.
What is that like, getting a phone call from the White House and being invited to talk about this?
It was incredible.
Paul went to Washington in late January of this year and says it was eye-opening.
Despite all the other differences that we have in our country politically, here was something that we could at least think about.
Paul made a book about his trip, thought his job was done, but then President Trump started talking about surprise billing too, that he wanted to end it. The White House called Dr. Davis again.
Also here with us today are Dr. Paul Davis and his daughter Liz from Findlay, Ohio.
It was a new presentation about surprise billing laws, and this time it was with President Trump.
The problem of improper medical billing affects most those who can afford it least.
During his speech, Dr. Davis showed the bill to the president.
That's almost not believable. You look believable, but look. But he's straight. $17,850 for a urine test.
A voice given to a guy from Ohio, a loving father, a retired physician, who isn't afraid to say what has to happen from here on out for you, the patient.
The providers have to say, wait a minute, we don't want this to happen anymore. The unethical providers needed to be weeded out, and we do need legislation. Unfortunately, I'm not a big government person, but there's no market force that's going to fix this, because the market forces are doing nothing but driving the prices up.
And here it is. This is just one example of so many patients that are hit with high bills, surprise bills, bills with mistakes. And here's where you come in. 5 on Your Side investigators want to see your medical bills, just like this one.
Tonight, we are digging into some of the most frustrating fees. Hospital facility fees.
Health systems say they're needed, but some billing experts disagree. 5 on Your Side investigator Jonathan Walsh continues our Diagnosis Debt series with a look at what's being done about facility fees nationwide.
I was born with rheumatoid arthritis, so I've had it all my life.
Karen Valori, 58 years old, from Avon Lake, and in pain.
It's been rough.
Knee replacement.
The surgeries.
5 hip replacements.
Takes a long time to recover.
Too many bills to even really count. And now she fears going to her own mailbox.
Because I don't know what fee's going to hit me next.
In addition to regular bills, patients like Karen are hit with facility fees tacked on.
Why are you going after them for facility fees and room fees? And this is just all crap.
5 on Your Side investigators contacted Cleveland Clinic, University Hospitals, and Metro Health. Metro sent us a pamphlet that mentions you may receive a facility charge, and it's up to your insurance on how reimbursements are shelled out.
This has just gotten way out of hand, and I'm really upset that the insurance company runs your life.
UH sent us a statement which says in part charges may reflect costs for items and activities. Cleveland Clinic says everyone charges fees, have been for years, and that these fees help cover services provided to patients and substantial costs.
That's certainly not what most of the empirical evidence supports.
So that's Christopher Whaley. He's from RAND. It's a worldwide organization. It's nonprofit, nonpartisan, and it's based on rigorous analysis. He says the reasons that the hospitals are giving for facility fees is called the cost shifting story, and it doesn't add up.
What's really going on is large systems are able to negotiate prices in some sense because they can, not necessarily because there have been changes to their underlying cost structure.
His nearly 10 years of research certainly goes along with medical bill advocate and expert in our area, Pat Willis, who said this about pricing procedures.
There's no really rhyme or reason for the fact. There really isn't. Every hospital, it's up to them what they want to charge. There's no law, there's no rules or nothing.
And when it comes to facility fees, reports show they're rapidly spreading to doctor practices, clinics, and surgery centers. Hospitals are quickly buying up smaller doctors' offices and outpatient services. In fact, the Physicians Advocacy Institute reports a 17% increase in hospitals owning physician practices.
The actual office is the same. You change the sign at the door. The hospital is now able to get a facility fee from these services.
Whaley says it's just another way for hospitals to make money. And not only are you hit with fees,
we certainly know that prices go up when physicians integrate with hospitals and healthcare systems.
Whaley tells us overall costs increase 10 to 20% when hospitals take over. The Centers for Medicare and Medicaid acknowledged that its beneficiaries were paying more for the same type of clinic visit in the hospital outpatient setting than the physician office setting. Within this past year, it lowered the copayment, so it doesn't matter which facility people use.
So that's something where at least there's some innovation on the federal side.
And it appears more and more states are going after the fees, too. Reports highlight Connecticut cracking down on facility fees and forcing health systems to make the costs clearer for patients. Karen would like that, and some kind of facility fee reform right here in Ohio.
I just think this whole process is ridiculous. They're nickel and diming you for everything. That is absurd.
I'm 5 on Your Side investigator Jonathan Walsh.
Hello. That's for you.
Miracles came calling.
Hello, Isaiah.
For little Isaiah and his mother, Elena McCruel, from Fairview Park. The first miracle? The pregnancy itself.
It was a surprise because I had cancer when I was a kid. So we had pretty much gone since I was 13 years old, thinking that this couldn't happen.
The miracle pregnancy didn't come without a cost in the form of complications. Isaiah was just too small. Not enough blood was flowing to him.
It got to the point where every week it was like, come back next week, come back next week, come back next week.
Then there wasn't a next week. Isaiah came into the world 3 months too soon. 1 pound, 6 ounces.
What did you think when you first saw him?
Honestly, I was scared.
Even though Elena is a trained nurse.
I've worked with preemies before, but when it's your own, and it's a totally different reality.
Isaiah and Elena needed so much help.
Very emotional. It gets to be depressing because the NICU becomes your life.
Their second miracle came from medicine.
I just wanted him to be okay.
All the treatments.
He's here.
All the care.
Who's your best friend now?
The tubes, the machines, the love that helped Isaiah grow during the 7 months he was in the NICU, all came together.
Just a great staff, and I felt like they took really good care of us there.
It was another miracle, though, that came with costs.
Do it. So you get something crazy like $90,000. And then you go, hey, we have insurance. There's also Medicaid here. Oh, let me fix that.
Then this one for $440,000, due, of course, upon receipt. What's your reaction?
I laughed. I was like, well, good luck with that.
Elena says she didn't have much luck, even though she had Medicaid.
A month goes by, get another bill. Oh, we don't have Medicaid listed. Do you have it? Yeah. Give it to them. Okay, we'll resubmit it. I've done that over 10 times.
10 times?
For sure, yeah.
She showed us the stacks of billing information, including pages upon pages of adjustments to her bills. Elena is not alone, and she won't be.
We know, in fact, in America and here in Cleveland, we have one crisis.
Stacey Stewart is the president and CEO of the March of Dimes.
Here in Ohio, a black woman, an African-American woman, is 50% more likely to have a baby born prematurely.
Her organization just came out with this study on premature births around the country. Ohio gets a C-. And out of the 100 largest cities in the U.S., Cleveland is dead last. Why is it that this area, known for medical care, is in this position?
Well, it probably is helping a lot of women. It probably just isn't enough.
This problem isn't going anywhere anytime soon. The study shows for the 4th year in a row an increase in preterm babies, with an average bill of $62,000 each in Ohio.
The greatest cost is borne by that baby and then by that family. But what we also need to understand is that society as a whole bears a risk for it.
At just 15 months old, Isaiah has made so much of his miracles.
A lot of moments where it didn't look like he was going to make it, so it's overwhelming joy.
But there's a long way to go for him, his mom, and the billing.
It puts a lot of burden on families. It's overwhelming.
It sure can be. University Hospitals tells us it's investigating Isaiah's case, and it apologized for any confusion that this has caused for Elena. Others shouldn't have to go through that.
No. Excuse me.
46-year-old Stacey Gambatese from Wycliffe, holding back the tears, left to think about what happened to her son. David Gambatese was born with asthma problems. They led to a cardiac arrest in 2014. He was just 13 years old when he died.
Your child's supposed to bury you, and I'm at a loss. My heart has a hole in it.
5 years later, Stacey was checking her credit report and found a massive bill tied to her son's care at university hospitals. And you had no idea?
I had no idea.
Nobody called you?
Nobody called. Nobody said. I never received a statement.
Date of service, May of 2013. Date of the bill, October of this year, $18,023.
I felt very blindsided. I was confused.
Stacey isn't the only one confused.
When I said something about, I shouldn't have to do this, they said, no, you have to pay this.
64-year-old Jean Wiesler from Cleveland. Her husband, Jeff, died from cancer in 2014.
I'm just tired. I'm just tired. I want this done. I don't want this reminder anymore.
She's been reminded of Jeff's death when she pays $100 every month to UH on the original bill of $13,000.
That's one of the toughest situations we see.
John Harrison is a Cleveland attorney who deals with estates. He tells us just last year the Ohio Supreme Court gave us a ruling saying that any creditor, whether it be a bank or medical debt, has to basically file a claim within 6 months of someone dying. If that doesn't happen, The debt is extinguished.
Ohio has chosen a process where it really favors the finality of those debts because it allows loved ones to move on.
In cases like Stacy's 13-year-old son, John says if parents sign papers agreeing to pay, they could be on the hook.
There might be some defenses to that, but the bottom line is that's outside of the probate process because that's their own individual contractual responsibility.
John says in Ohio law, though, there's still a question of can surviving spouses or parents afford to pay?
How does one determine what the ability to pay is? That's an issue in this statute that's, because it's a gray area, what does it create? It creates uncertainty.
Barb Wonderly, originally from our area, wonders about her bills. She's been paying $100 a month as well to university hospitals after her husband Tom passed in 2016.
There are months when I go, and I know my daughters yell at me, and I don't even get my prescriptions filled because I don't have the money.
I am in a major debt right now. I mean, I'm barely treading water at this point.
And get this, Stacy's already strapped with $33,000 in student loans. And now getting hit with a bill for $18,000?
I might have to file a bankruptcy. How's that? Because of this.
Medical debt contributes to 2/3 of all bankruptcies. 2/3.
Sometimes I feel like a real failure.
Is the system screwed up? Yeah, the system is screwed up.
I'm sad. There's not a day that goes by that I don't miss my son. I just feel coming back almost 5 years later is ridiculous. It's not fair.
I'm 5 on Your Side investigator, Jonathan Walsh.
And after 5 on Your Side investigators contacted university hospitals, it sent a statement saying in part they offer sympathies to these families on their loss. A UH representative told us its financial team is looking into each of these cases. UH's full statement is on our app.
I can describe it as just horror. I was literally screaming.
It was early July. 75-year-old Maurice Sears from Shaker Heights in pretty bad shape.
He was in excruciating pain. He could not stand up.
His wife, Cassandra, says Maurice had to go to a Cleveland Clinic ER several times. On the 5th visit, he was finally hospitalized.
He was sleeping in their beds. He was receiving medication. Doctors were coming in and out.
After coming home, the bills then started piling up.
$2,367.66, $7,221.23.
Fear, shock, just baffled by the bills.
$805.06.
What went through your mind?
It's outrageous. I've never heard of anything like that before.
Cassandra tells us the hospital billed Maurice's 5-day hospital stay as an observation rather than a regular hospital admission, which would have been covered by his insurance plan. An observation is not.
If you were in ER for 4 visits, isn't that enough observation? 4 visits.
Collect what they were.
At one point, insurance even wrote,
"Your provider has been informed this service was billed incorrectly."
You name it, and we've probably seen it.
Brian Eccles is from a company called MedLiminal, where they find coding errors in medical bills. He says they're uncovering tons of mistakes every year across America.
$10 billion of overcharges that consumers are charged for in excess of what they should be charged by hospitals.
Part of the problem with coding errors, well, check it out. There are tens of thousands of these things. Very specific labels that go on and on and on. These papers right here represent just 130 pages out of the nearly 3,000 pages of codes. And that's just one category of codes. Here's another one. And there are even more out there.
Brian tells us his company found a bill that said an infant got a $66,000 dose of a medication 4 times, totaling more than $250,000. But
in our research, there is absolutely no way that a newborn infant could have ever withstood that much of that medicine.
They helped shave $180,000 off that bill. Brian says you can help yourself by having you and or a loved one pay very close attention to what's happening at the hospital.
Try to keep a journal of what services were provided.
He says never hesitate to seek out information.
Encourage healthcare consumers not to be shy about asking what tests are being performed.
Brian tells us the stakes are just too high.
Healthcare cost is across the board one of the #1 reasons why people are in debt, and even worse, on the extreme case, are in bankruptcy.
It's something the Sears certainly want to avoid as they continue to have confusion about their bills.
It's frustration and anger. And how can they do this?
I felt betrayed. I thought we were covered.
I'm 5 on your side investigator, Jonathan Walsh.
Well, it's fascinating stuff, and we kept Jonathan here because you have a late-breaking update now on the case.
Very interesting, Rob. Just this afternoon, we heard from the Sears, and after we got involved with this case, that nearly $10,000 medical debt is down to $1,000.
Well, there you go. But
yeah.
How does something like that even happen in the first place?
So Cleveland Clinic did admit that there were coding errors, but they blamed the insurance company. The insurance company then blamed Cleveland Clinic, and then the Sears, of course, stuck in the middle until all parties figured this out.
Until you got on the case.
Well, we helped. Really, really good news for you guys tonight. We have been able to help several people totally get rid of or at least drastically reduce their medical debt, including Dan Mascarenas, who was all smiles when we met up with him again.
And it was $57,000 and some change.
57 grand.
57 grand.
You might remember that huge bill Dan Mascarenas told us about 2 weeks ago. He had surgery, and there was some confusion between Cleveland Clinic and his insurance policies.
No one really had eyes on it.
Until we were involved.
Until you were involved.
After we called the clinic, it reacted right away.
An hour or two after I talked to you, Cleveland Clinic called me, reversed all the collections.
Dan says he just got word. That $57,000 bill, he now owes pretty much what he thought he would pay in the first place, about 10% of it.
Even if it is $5,700, still better than $57,000. And my son and I are probably going to go buy something. I don't know what. Probably a plane or something. Model plane.
Model plane for sure. Now get this, Dan is still waiting on some information about his deductible that could get that final bill down to only $1,000. We'll stay on top of it, but still pretty cool.
72 million Americans are struggling with medical debt right now.
And that debt can keep people from buying homes or force them to forego everyday needs, even put them into bankruptcy. And that is why News 5 is helping wipe out about 800 serious medical bills here in Northeast Ohio.
Today on Good Morning Cleveland, News 5 launched the next step in our ongoing series called Diagnosis Debt. 5 on your side investigator Jonathan Walsh live right now in Elyria, a community that will directly benefit from today's announcement.
As a matter of fact, Rob, News 5 has teamed up with the national nonprofit group called RIP Medical Debt. Those guys go out and find the people who are in dire need of medical debt relief. In fact, here in Lorain County, our donation will help eliminate 100 debts. The next level of our coverage here is now called Diagnosis Debt Rescue. When you woke up, what did you feel like?
I just didn't feel like myself.
73-year-old Claudia Simpkins from Cleveland was having some problems with her high blood pressure. She ended up staying one night in the hospital.
I got a bill from $26,000.
26 grand?
Yeah, over 26.
What did you think when you saw that?
I was flabbergasted. I said, well, what the hell did they do?
Claudia lives in a neighborhood that has its challenges. Her home has certainly seen better days. Her resources are scarce.
My income don't allow me to pay a bill like that because the bills that I pay takes most of my income.
There's $5 billion of medical debt just for Cleveland, your viewing area alone.
Craig Antico is the co-founder of the nonprofit group called RIP Medical Debt.
We say, look, why don't you leave these people alone who fit into this particular category?
Jerry Ashton is the other co-founder. Together, they've seen just how huge the problem of medical debt really is.
15 million Americans will deplete their life savings. Many more will go bankrupt because of medical debt.
One surgery can be absolutely devastating.
Dean Palucci is the owner of Palucci Law in Akron. It's a small law firm that still files about 30 bankruptcies a month. 75% of them have medical bills attached.
And that's sad because I know that that's sleepless nights, that's not being a good, mother or father to your kids because you're stressed out all the time.
These reasons and so much more led News 5 to team up with RIP Medical Debt. Our $15,000 donation will get rid of $1.5 million worth of medical debt in counties all over Northeast Ohio.
You're a station that stepped up and said, there's a community benefit that's involved here. Why don't we take some of the money that we have and invest it in the city?
Investing in people like Claudia.
I don't try to live beyond my means because I can't. I can't afford to live within my means.
And think about this, just right here in Elyria where we are, our donation will help eliminate 22 debts. Can you believe it? And overall, hundreds more debts will be relieved in counties all over Northeast Ohio.
All right, Jonathan, we've heard from some people today asking for us to forgive their medical debt.
Yeah, I wish we could, right? I wish we could just hand out money and relieve that. But this is how this process works. RIP Medical Debt goes out and actually finds as much debt as they can for the donation that we gave. It's randomly chosen, and in fact, we don't even know who all are going to get the golden envelopes and letters saying that their debt has been wiped out. Guys?
Aha, the golden envelope. It's the golden ticket. Look for these envelopes in your mailbox.
Jonathan, we've gotten a big response from this program.
Absolutely. I mean, people from all over the place are telling us how excited they are about the chance to have their bills wiped clean. And it's so needed in our area. Just ask Timothy Majors, whose medications are many, and his debt is rising.
It's starting to get to be overwhelming and out of control.
48-year-old Timothy Majors from Olmsted Falls had no idea his body was working with just one kidney back in 2011.
But when that second one fails, now you're in trouble.
After 5 years on dialysis, he was fortunate. He got a kidney transplant, but that life-saving surgery came with side effects.
I didn't know about all the complications. I didn't know about the side drugs that I was going to have to take.
He had been taking 36 pills a day, anti-rejection drugs. He's now down to about 15, but he's on disability, unable to pay the thousands of dollars for treatments and his meds.
They stopped delivering because my bill got so high.
They just won't send you.
They won't send them anymore. No.
It's odd where ideas can come from and miracles can happen.
With people just like Timothy in mind, Jerry Ashton co-founded RIP Medical Debt with Craig Antico. News 5 just donated $15,000 to that organization, which is wiping out, get this, $1.5 million worth of medical debt in Northeast Ohio.
It's a miracle that we were able to get into this industry.
Their nonprofit organization came from the Occupy Wall Street movement 8 years ago. Jerry says one group involved in that movement wanted to abolish medical debt. But when Occupy ended, that group decided not to move forward.
And we looked at each other and we said, well, we can't let this idea drop.
Interesting thing, Jerry and Craig were debt collectors, had been for decades, hitting the streets, collecting debts of all kinds, including medical. They saw the system, they knew what was going on, they wanted to do something differently for the millions of people across the country in medical debt.
I mean, it's staggering. I mean, where do we start is what happens in our minds.
It was long hours, long weeks, long years putting together a national nonprofit having such lofty goals. They knew they had to buy the debt from collection agencies for as little as possible.
The value of a debt is based on how much you imagine you can collect.
And if agencies aren't getting the money they thought, that's when RIP Medical Debt steps in.
That's why there's an ability to work with these collection companies and abolish the debt that they'll never have a chance of collecting, but they constantly keep trying.
And that's where donors come in too, companies like Scripps and News 5. Donations help wipe out crushing medical debt.
I don't think we've ever worked for a better boss than the people who are donating money to us.
And they're all working together for people like Timothy, whose medication bills are growing, along with his bills for treatment.
I can understand why people stop paying, because they just can't afford it, and they go back into kidney failure.
Wow. And Timothy says he's been told now he makes too much from his disability benefits to get more coverage for his condition. So, guys, that's just one of many reasons why we're doing this, trying to help in any way we can to avoid that scenario and so many others.